Hey guys, it's Justin Hayes here with justinsurance.net. Just bringing you a new topic today about how the Affordable Care Act may be changing due to the government shutdown. Right now, everything is in limbo. We don't know what's happening. The Democrats are holding out to extend the enhanced advanced premium tax credits. That's a mouthful. And the Republicans are holding out to, I guess, negotiate on their own terms and not extend the enhanced advanced premium tax credits. So a lot of people don't really understand what the argument is about or how it would affect them. So I thought I'd do a quick video to give you guys some insight as to how brokers think and how we go about looking at things and to apply it to some real world examples so that you can see how it might affect your particular situation. So first thing, let's start with this nifty tool online that is recently become announced at kff.org, which is self-described as the independent source for health policy research, polling, and news. And on this website, you can go ahead and put in your state, zip code, county. I've just put in something local here as I'm in Texas, but I do work with 10 different states. So if you're in a different state, definitely check out, see if I could help you. This is the income that we're going to put in. We're going to start. Well, I just want to show you what happens if you put 20,000 in this great state of Texas with a household size of two, and that's one adult and one child. We'll just go with age 34 and age 5, and let's check and see what happens. So in this case, you're making 95% of the federal poverty level, which means you are not eligible for any financial help. Look at that. No financial help. It doesn't make a difference about what they're arguing about in Congress right now. That will not matter. You're not getting any financial help. What's going to happen is they're going to send the 34-year-old to Medicaid. They're going to send the child to CHIP. So it says right here, reach out to CHIP or Medicaid and see if you can get help. I can tell you in the great state of Texas, unless you are pregnant or possibly a woman, you're probably not going to get any kind of Medicaid, but the child could get CHIP. That's a definite possibility there. You got to go through some paperwork. It's a process, but you can do it. So this person would not be a good fit for the Affordable Care Act because they just don't make enough money. But if we come up just a little bit to $22,000, so that's going to put you at about 104% of the federal poverty level. And look here, it says without the enhanced premium tax credits, which is what they're arguing about in Congress. That's why the government is shut down right now. You will likely remain eligible for financial help, but at a lower level. Let's see how much lower level. Oh, and by the way, at this level of 104% of the federal poverty level, they are going to still want to keep the children on CHIP. So I believe that is in the great state of Texas, anything less than 200% of the federal poverty level, the children need to go on CHIP. So this is why you want to work with a broker if you can. I mean, it seems real simple to sign up online, but you get some expert advice when you do choose to work with a broker. Uh, Now let's look at the exact differences here. So with the enhanced premium tax credits, you would pay zero for a silver plan. And in this case, silver plan is actually going to be your best option because you're near the Medicaid level, but you're not at the Medicaid level. So with a silver plan, you're going to get two things. You're going to get the advanced premium tax credits, which are also enhanced, and you're going to get the cost sharing reductions, which will help lower your copays. So you might see things like $10 copays on specialists, phenomenal copays as well, because you're close to that Medicaid level. So silver plan's the way to go here. Now, if they let the enhanced premium tax credits expire, which is currently what is happening, that's why the Democrats are up in arms right now. If they let them expire, you would pay $39 per month for this plan, for a silver plan. Okay. For a bronze plan, it's not going to make any difference at all. You're going to have a zero premium for a bronze plan, whether the enhanced premium tax credits expire or not. Now, bronze plan, of course, that's catastrophic coverage, probably has a $9,000 deductible. It's definitely better than nothing, though. So sometimes you can find bronze plans that'll have like a $50 copay for primary, a $100 copay for specialist. Just depends what's available in your zip code. But certainly better than nothing. You're also getting those network negotiated rates, plus your preventative blood work. That's typically always going to be zero cost, as well as your 10 essential health benefits that are covered as a part of the mandate of Obamacare, the Affordable Care Act. So that's the being right at the poverty level. It's about a difference of $40 a month. And that, it can be impactful for someone that's right at the poverty level with one child, right? Um, but not a huge amount of money for excellent healthcare. Still getting those cost sharing reductions. But let's take it up a notch and let's double it. Let's go to 44,000. Now, this puts us at 208% of the poverty level. One of the things you'll notice is that the advice to get CHIP for the child has gone away. So the child is going to be on the plan as well now through the Affordable Care Act. And your cost for a silver plan, if the enhanced premium tax credits do not expire, so this would be if the Democrats have their way and they win the argument, it's going to be $85 per month for a silver plan. Cost sharing reductions at this level at 208%, you're probably not going to get any cost sharing reductions. So silver plan still looks good, but doesn't look as good as it would if you were close to the Medicaid level. Now, if the Republicans have their way, which is actually the way that it's not that the tax credits are already set to expire. So the Democrats are arguing to extend something that's already been written to expire at the end of this year. But if the Republicans have their way and the tax credits do expire as planned, the silver plan is going to be $253 a month for a family of two making $44,000 a year. That's pretty significant, right? I mean, that adds up at the end of the year. That's $3,036 per year. It's almost 10%, not quite, but it's 7 and 8% of your income. And you got to remember the 44,000, you're probably still paying some taxes on that. So it's pretty close to 10% of your income. And you haven't used your health insurance yet. You still have a deductible, you still have copays. It's just to have health insurance, 10%. This inflationary environment, that could be challenging and stressful for some families. I definitely can see where that anxiety would be coming from. But for a bronze plan, still no difference. You can get a $0 bronze plan either way, whether the tax credits expire or not. You'll have some sort of health coverage for zero at this income level. Now let's take it to the next level here. I'm going to double it again. So we're going to be going basically to 400% of the federal poverty level now. And looking at this, we see that if the enhanced premium tax credits expire, there is no financial help at all. So you'll be paying the full cost of the plan, which is really, really high. I mean, it's $1,053 per month, 14.36% of your household income. It says it right there. It's 14.36% of your household income. That's a lot. And this is for people making 416% of the poverty level. And that may seem like a lot, $88,000, right? But keep in mind they're paying taxes out of that. They don't get to keep the whole 88,000. And then 14% of that is going just to pay for their health care. They're not getting any cost sharing reductions. So these people are very impacted, I would say. It goes from 8.5% of the household income if the enhanced premium tax credits are extended to 14.36% if they are not extended. So that's a jump of $400 or so. And it's percentage wise, it's substantial. It's almost doubling the percentage of your income that is required just to maintain healthcare. Keep in mind, you haven't used your healthcare yet. You haven't paid any copays. You haven't met your deductibles. There's no cost sharing reductions at this level. You're not getting any extra perks at all. There's no chip for the children. So these people are going to be impacted the most. Now, the good news is if you are fairly healthy, you can get into private health insurance for a lot less money, for about half of the price. And it's going to be better health care coverage. Private insurance is what people often refer to as Trump care. I mean, there's no such thing as Trump care, but whether he admits it or not, he is encouraging people to go into the private market simply by the unaffordability of the Affordable Care Act. But that's kind of the nature of the beast, is that the Affordable Care Act just goes up and up every year. So Hard to say what will happen in the future, but if only sick people sign up for the Affordable Care Act and everyone else goes to private insurance, then the price of the Affordable Care Act has nowhere to go but up. So that is the situation, folks. And now you know what's going on with the government shutdown. You have some idea about what they're arguing about. And hopefully you can make more of an educated decision. I will show you just one more thing here. This is the enrollment tool that we use as brokers. Now, I'm just going to go ahead and put in the same data that I had over there with the $88,000 income, two people in the household. Then we're going to look at some of the plans that are available. So we do have several bronze plans that are available. Again, you see in the very high deductibles on those, 10,600. So remember, the deductible is the amount that you pay before your health plan starts helping. And look, there's no charge for your doctor's visit after you meet that $10,600 deductible. So bronze plan, definitely not the way to go. If you're in this category, guys, reach out to me. Let's talk. We've got private insurance that's way better. And probably a much lower price, definitely a lower price as well than even this 720. Just to give you some idea too, if we look at the gold plans and the silver plans, wow, 859, $2,000 deductible. Okay, well, $2,000 deductible is reasonable. We can do better for two people in a family with a private health insurance plan. We can probably get you a $500 deductible. Reasonable doctor's office copays. Then Oscar has one $3,300 deductible. So there's several options available here. And if you do have questions about health insurance and you'd like to take a look and see what's available, you're kind of confused by all the mess. You want somebody to help you check your doctors, help you check your medications, help you understand your plan. That's where working with a broker comes in. I mean, yes, you can do it yourself online, but would you buy real estate by yourself without ever consulting with an agent? It's up to you. Some people do. Some people take their chances, but it doesn't cost anything to use an agent, to use a health insurance, licensed health insurance agent like myself. So take some time, reach out. My website is justinsurance.net. Take some time to research your health insurance this year. Everything is changing. So this is a great year to take an active interest in your health insurance. I just had a client today who did the opposite of that. I called him. He said, "Hey, I'm at the gym. Send me a quote in the email." I said, "Well, tell me a little bit about your plan so I know what you're comparing it to. I don't know anything about my plan. Just send me a quote." That's the opposite of taking an interest in your healthcare. So he got a quote, but I kind of think that goes nowhere. We want to know a little bit about what you've got right now to compare it to what's available. And that way, really make an argument for getting you a better plan. If you get in touch with me, it's not about a high pressure sales technique. It's about doing a comparative analysis and trying to find you better coverage at a better price. All right, that's all, guys. Visit me at justinsurance.net because it's about the net, not the gross. And I look forward to talking to you soon.